You are in pain. Real, serious pain. Your tooth has been throbbing for 3 days. Your leg is infected. Something inside your chest rattles when you breathe. And there is no hospital, no pharmacy, no doctor within 1,000 miles. Because the concept of a doctor does not exist yet. What do you do? For most of human history, this was not a hypothetical. This was Tuesday. This was every generation before yours, stretching back roughly 300,000 years. And somehow, they survived. Not by luck, not by accident, but because your ancestors developed a pharmacopoeia, a medicine cabinet, so sophisticated that modern scientists are still reverse engineering it today. Some of what they used will surprise you, some of it will disturb you, and some of it you will recognize from your own kitchen cabinet. Let's start with the obvious question. How do we even know what ancient humans used as medicine? They left no prescription bottles, no clinical trial records. The answer comes from 3 places: archaeology, ethnobotany, the scientific study of how human cultures use plants, and the behavior of our closest living relatives. In 2012, a research team led by archaeologist Karen Hardy from the University of York analyzed the dental calculus, the hardened plaque, of a Neanderthal individual found at El Sidrón Cave in northern Spain. What they found inside that fossilized plaque stopped the team cold. Embedded in the calculus were traces of yarrow, groundsel, and a woody-stemmed plant called ephedra. None of these plants are calorie-dense. None of them taste good. There was no nutritional reason to eat them, but all 3 have well-documented medicinal properties. Yarrow is a natural anti-inflammatory and blood coagulant. Ephedra contains compounds that open airways. It is the plant ancestor of the modern decongestant pseudoephedrine. Your ancestors were not just eating, they were dosing. And this was not isolated behavior. Across the world, in cultures with no contact with one another, anthropologists have documented strikingly similar plant-based remedies appearing independently. This phenomenon is so consistent that researchers call it convergent ethnopharmacology. The idea that when humans are presented with the same biological problem, they tend to find the same biological solution. Pain, infection, fever, wound closure. The plants differ slightly by geography. The logic does not. Now here is where it gets strange. One of the most commonly documented ancient remedies was not a plant at all. It was mold. Long before Alexander Fleming discovered penicillin in 1928, a moment we treat as the birth of modern medicine, ancient Egyptians were packing infected wounds with moldy bread. This is documented in the Ebers Papyrus, one of the oldest surviving medical texts in the world, dated to roughly 1550 BCE. But the practice almost certainly predates writing. Similar applications of mold and fermented plant material to wounds have been documented in ancient Serbia, ancient China, and among indigenous communities across South America. They did not know what mold was at the microscopic level. They could not see the penicillium spores. They only knew that wounds packed with it healed faster than wounds left open. The result was the same as the antibiotic. The mechanism was invisible to them, but it worked. Let's reconstruct a scene. Imagine you are walking through a forest somewhere in what is now northern Europe, roughly 12,000 years ago. The ground is cold. The trees are dense. A member of your band, perhaps a child, perhaps an elder, has a deep gash on their arm from a flint knapping accident, where sharp stone flakes were being shaped into tools. The wound is red at the edges, warm to the touch. It is beginning to smell. You recognize these signs. Every adult in your group recognizes these signs. They mean the wound is turning. So you do what your mother taught you to do. You chew a wad of yarrow leaves into a paste and press it into the wound. You pack strips of bark from a white willow tree, the bark that contains salicin, the compound that would eventually be synthesized into aspirin. Over the top, you bind it with plant fiber and you watch. The child lives. Was this medicine? By every functional definition, yes. It was targeted. It was intentional. It was passed down through direct instruction, generation after generation, across thousands of years. Ethnobotanist Paul Allen Cox, who has spent decades documenting indigenous pharmacological knowledge in Samoa and across the Pacific, argues that traditional medicinal systems represent accumulated clinical knowledge on a scale that modern pharmaceutical research cannot yet fully replicate. These were not guesses. They were conclusions drawn from an unbroken chain of observation stretching back further than any written record. But let's go further, because some of the remedies your ancestors used were not just surprising, they were genuinely alarming. Clay. Your ancestors ate clay. This is a behavior called geophagy, the deliberate consumption of earth, and it has been documented on every inhabited continent. At first glance, it sounds like desperation, like starvation behavior, but analysis tells a different story. The specific clays consumed by traditional cultures are almost always kaolin-rich. the same compound used in modern anti-diarrheal medications like chiopectate. Chiolin binds toxins in the gut and prevents them from crossing the intestinal wall into the bloodstream. When your ancient ancestors ate tainted meat, which happened regularly in the absence of refrigeration, the clay acted as a poison neutralizer. Some researchers, including primatologist Michael Huffman at Kyoto University, have documented the same behavior in chimpanzees, who selectively consume specific clay deposits after eating bitter, potentially toxic leaves. This was not random. The animals, including your ancestors, had mapped their environment with a precision that we are still only beginning to appreciate. Maggots. Deliberate wound packing with maggots, specifically the larvae of the green bottlefly, was documented across indigenous Australian cultures, ancient Mayan medicine, and in 16th century military surgery. The larvae do something no bandage can. They eat dead tissue with extraordinary precision, leaving healthy tissue untouched, and they secrete compounds that kill bacteria. Modern wound care has readopted maggot therapy, which is now used in hospitals across the United States and Europe for chronic wounds that resist antibiotics. The ancient world did not abandon this remedy out of ignorance. It was abandoned during the era of antiseptics, when the appearance of sterility was prioritized over functional outcome, and then quietly rediscovered when the outcomes proved undeniable. Fasting. Controlled, intentional fasting as a medical intervention appears in virtually every traditional healing tradition on record. Not as spiritual purification, though that framing was often layered on top, but as a practical response to infection and injury. When your body stops digesting food, it redirects significant metabolic resources toward immune function. Modern research into autophagy, the cellular process by which your body breaks down and recycles damaged cells, which earned Yoshinori Ohsumi the 2016 Nobel Prize in Physiology, has given a molecular explanation for something your ancestors practiced intuitively. They could not name the mechanism, but they had observed, over generations, that sick people who did not eat often recovered faster than sick people who forced themselves to continue eating. They were right. And then there is one of the oldest and most consistently documented, trepanation. Trepanation is the oldest known surgical procedure in the world and across sites in Africa, Asia, and the Middle East. Here is the part that stops most people. A significant percentage of those skulls show bone regrowth around the hole. The patients survived. They recovered. Someone, a healer, a surgeon, a specialist by whatever name they were called, opened a human skull, addressed whatever was inside, pressure, clotting, infection, and closed it well enough that the person continued to live. We do not know everything they were treating. Researchers believe trepanation may have been used for skull fractures, chronic headaches, seizures, and possibly mental illness, though that last category is harder to confirm archaeologically. What we know is that the procedure was performed skillfully enough to allow survival at rates that would have been respectable even in the early 20th century, before modern anesthesia and sterile technique. Here's the counterintuitive truth underneath all of this. For most of human history, medicine was not primitive. It was empirical. It was based on thousands of years of direct observation, careful transmission, and iterative refinement. The gap between your ancestors' pharmacopoeia and a modern pharmacy is narrower than you have been taught to believe. Roughly 25% of all modern pharmaceuticals are derived from or directly modeled on compounds first identified in plants used in traditional medicine systems. Aspirin from white willow bark. Quinine, the malaria treatment, from cinchona bark, which Andean peoples had been using for centuries before European contact. Digitalis, the heart medication, from foxglove. Morphine from the opium poppy. The Industrial Revolution did not invent medicine. It scaled it, purified it, and packaged it for a civilization that no longer had time to chew its own yarrow leaves. Which brings you back to today. Your medicine cabinet, the ibuprofen, the antacid, the cough syrup, is a compressed, refined, dose-calibrated version of something your ancestors assembled from the forest floor, from fermented grain, from the specific clay deposits in the riverbank, a 3-hour walk from camp. They didn't have the chemistry, they had the observation, they had the time, and they had something that no pharmaceutical company has ever been able to manufacture. A relationship with the natural world so intimate that they could read it the way you read a label. The next time you swallow a pill for pain, know that somewhere behind it, stretching back further than writing, further than agriculture, further than the first city wall ever raised, someone was already doing this, chewing the right leaf, packing the right wound, watching to see what happened next. They were paying attention, and so, it turns out, were you.